Okay, I know we have a lot of future dentists watching, so let's start off with the true or false question. So, true or false? Teeth are bones. Pause the video and then try to answer in your head, then resume the video. One, two, three, and the answer is false. They are not considered bones. And then true or false? Teeth can die while they're still anchored in your gums. So they're still in your mouth, but can teeth actually die while they're still in your mouth? True or false? Pause the video, try to answer in your head, then resume the video. 3, 2, 1, and we're back. So they can, yes, they can die while they're still anchored in your gums. Now, our future dentists, I know you're very interested in this, but we're just going to cover it very briefly and the very basics. Now, what do we see here with this? Like, take you to say you just take a tooth and just cut it in half, and look at the insides. What we see are different layers of the tooth. So you may have heard of the tooth enamel. So that's the outer layer right here, and then there's actually another layer underneath that called the dentin. Then we have the gums, the gingiva surrounding it. So when you have that gingivitis, that's the inflammation of those gums over here. But what we see here are these nerves, our nerves and blood vessels. So blood vessels over here. We have our arteries and veins. So yes, teeth are living tissue. So if something happens to this tissue, yes, a tooth can die while it's still in your socket. And there's also all these nerves seen over here, so that's why teeth, when they get inflamed or some sort of trauma happens to them where they get damaged, that's why it's super painful, because you have all these nerve endings. And this is why if you crack a tooth, it has all these blood vessels as well. But back to the original question, are teeth considered bones? And they're not considered bones. And if you look at the cross-section of a bone compared to a tooth, now if you thought teeth were bones, don't feel bad. Like before I started taking undergrad classes in anatomy and physiology, I thought they were bones too. So yeah, they have commonalities. They are hard. They have a lot of calcium in their structure, and when we die, they're left over. But as we see from here, their development is different, and teeth can't really repair themselves once they're damaged, and that's why we need to go to see the dentist. And then, but bone, they have all these cells right here that help to remodel, remove damaged bone, and replace it with stronger bone matrix. Now, well, if you have a tooth, but it dies in the socket, well, you might need something painful called a root canal. Hopefully you've never needed one in your life, but yeah, take good care of your teeth because it really sucks to go through one of these. So what do? Like say you have an infected pulp, and that's what we call this part right here with all the blood vessels and nerves. And with all that blood there, anything like, especially the bacteria in your mouth, they love that stuff, full of nutrients, and they can just multiply like crazy. So that's really going to infect it, and the thing about that is that you don't want that infection spreading elsewhere in your body because you have blood vessels leading to and from this pulp. So this is also why it's very painful, because you have those nerve endings. So what do? They basically gut out the pulp and they take out this inflamed tissue. So this essentially kills the tooth because now you no longer have blood vessels and you no longer have nerves. So they replace it with this gutta percha. I don't know. I have to ask a dentist how to pronounce that, but yeah, they replace it with something. It's not living tissue anymore, so it's just a hollow part. They fill in that hollow part and with something that's sterile, and they put a crown on it to cap it off. So yeah, the tooth that's undergone a root canal is a dead tooth. But again, would you rather have no tooth at all? That's would you rather have an empty socket that can't really help with chewing, or would you rather have a tooth, like, even though it's dead, it's still able to help provide mechanical digestion? Now, deciduous and permanent teeth. So deciduous, in terms of ecology and nature, this refers to like the shedding of something that's temporary. So these structures that aren't meant to last come for life. So an example of these are like leaves on trees. Like we don't really get this in Hawaii because we have like more, we don't really have like 4 seasons. We have like 2 seasons. We have like the wet and rainy monsoon season, and then we have summer. But in places that have 4 seasons, what you might see are things like fall leaves, and these are deciduous trees because they shed these leaves every season, or every fall season, I should say. And antlers. So the thing is that for animals that have antlers, they shed their antlers as well. So these are considered deciduous as well. And when we have our deciduous teeth, that's just the anatomical term for baby teeth. And so we're meant to shed these teeth, not keep them forever. And then what replaces these deciduous teeth are our permanent teeth, and permanent because again, if you don't take care of your teeth, you might lose them. But these are the adult teeth, the second set of teeth that eventually replace your deciduous teeth. So do I expect you to know the deciduous teeth? I'm going to leave that for your more advanced classes, and for this class, do not worry about the dates of eruption. That's another layer of information I think is more appropriate for those of you going into dentistry or pediatrics. Now here are the adult teeth, and do I want you to know the dates of eruption? Again, no, but I want you to identify the different types of adult teeth. So we have incisors, and these are the blade ones, so these are our front teeth, and the ones also to the side right here. So there's 4 on top, 4 on bottom. And then over here, so these are kind of like little chopping knives. They help to clip your food and help to mechanically chop it up into smaller slices and bites. Then you have the cuspids, also known as canines. You should know both terms because they are sometimes used interchangeably. So there are 4 total. They're on the sides of your incisors, and they have those little points. So like if you see those like vampire movies, then their canines grow and they grow those fangs. That's what we're talking about there. What are the whole purpose of that? Well, they have that little point to help tear up your food. Then we have our premolars. So the premolars, they are called bicuspids because they have 2 points on their surface. It's kind of hard to see in this picture, but just feel your own bicuspids that are next to your incisors. 8 total, so again, you have left, right, you have top, bottom, so there are 8 total premolars. And their purpose is to help to mash up, but also pass it off to your molars. And there are 12 total, assuming you haven't had a wisdom tooth removal. And there are 6 on top and 6 on bottom. So where are your wisdom teeth? Okay, so the ones furthest back, those are your third molars, and those are your wisdom teeth. So if you've had those removed, well, if you have the full set, including your wisdom teeth, you have 32. But if you have a wisdom tooth removal, what do you have? 32 minus 4. So our learning objectives here, so we just talked about the general arrangement of teeth and the different types of teeth in your mouth, and you should be able to define deciduous and permanent teeth.